Hello friends, this is the second part of Carcinosin. In the first part, I tried to explain two important traits of Carcinosin. One is bipolarity, another is changeability. Carcinosin today is a very important, a very indispensable drug, and while prescribing carcinosin, these 2 points are very important, and especially bipolarity. We try to find out bipolarity in patients. In every patient that we feel that it may be a carcinosin patient, we try to find out bipolarity, and in mostly it is found in carcinosin patients. And changeability may be, sometimes we find, sometimes may not be, but bipolarity is very frequently found. Now in this part also I will give another example of bipolarity to make it clear. Bipolarity, in the first part I told a case where the same patient had oversympathy as well as cruelty. Now that is a trait of bipolarity. Bipolarity can be in other forms also, like the same patient, in some matters he is very fastidious, means fastidiousness is found in some aspects, whereas again the same patient, he or she may have a habit that is very dirty. Simultaneously he is fastidious as well as dirty. Then this is a bipolarity. Then we can find a patient very courageous in some incidents in his life. From those incidents he is found to be that he is very courageous. But simultaneously there are other aspects where he is found to be very afraid, his morbid fear of something. So simultaneously he is in few matters, like a person I know, a patient whom I have seen, that he was a social activist in young age, and he was very courageous. He was always going into the front of every problems, activism. He was front runner, very courageous. But that same person was afraid of thieves. If sometimes at night he was living in a remote place, his house was in a remote place. In the night, if some sound is heard from outside and somebody says that I think a thief has come, he will hide behind the almirah or under the bed. So like this. So there are other cases where I have found a patient who is very courageous in one or two matter, and simultaneously he has morbid fears also. So this is bipolarity. Then another case today I will explain. A lady, she had gastric complaints, severe gastric complaints, as well as arthritis, and she came to me. During case taking, when I asked about her nature, her daughter also came with her, and then narrating, she was telling, and her daughter was also telling. When I asked about how much sympathy do you have, if you see someone in pain or in bad condition, how much do you feel? How much sympathy do you have? And immediately the daughter told, yes, she has sympathy. She also told, yes, I feel bad. But then nothing was very characteristic I found. Then after pressing more, I asked different incidents. This is my nature. When during case taking, I ask different circumstances and then ask questions. So I asked her that, do you watch movies? Then she told, yes. Okay. Then I asked, okay, if you are watching movies, while there are emotional scenes in movies, or in the television, if you're watching dramas, emotional scenes are there. How much sad do you feel? Immediately the lady, before the lady says anything, the daughter is telling that, oh my god, then my mother will start weeping immediately. Immediately tears will start rolling down her cheeks. So I took down the symptom oversympathetic. This is oversympathy. And this same patient, after a while, when I found that while her children were small, they were small kids studying in 1, 2, 3. If those kids used to do mistakes in calculations, the lady will be so angry. She will pull her daughter's hairs and then take the pencil which is very sharpened. The sharp pencil she will take and she will prick the tip of those pencils on her daughter's fingers and make her calculate. Now count. Make her count in 1, 2, 3 like this. She will prick the tip of the pencil on her fingers of the daughters and make her count. And in this way she will teach. Now will you remember? I think you will never forget this. So this is her way of punishing. And the daughters, if when they are getting the pain, they are afraid to even weep or cry because they were afraid that the mother will be angry, very angry. So I found that, oh my god, this is torture. She is pricking the pencil tips hardly on the fingers of her daughters and they are getting pain, but they are afraid to cry. This is torture. And I note down cruelty. So see, this is cruelty. One side she is oversympathetic in some things, some matters she is oversympathetic, and again in some matters she is so cruel, she is so angry that punishing the daughters so harshly that this is cruelty. This I noted down as bipolarity. So this is another thing you may find in patients, that in some aspects she is very oversympathetic, in another aspect he or she is cruel. Another example that I will tell, where I found a patient, he was very fastidious. He won't let anybody touch his towel, his soap. Nobody will in his home. He had separate soap and towel. Even if somebody is touching, his children are touching his shelf, he will be very angry. He will keep everything in very perfectly. But this same person, he would wear his t-shirt and pajama for days long, and at the end of a week, if the wife takes those clothes and give for washing, then only they will go for washing. Otherwise he has no botheration. He will keep wearing them and the clothes will start stinking. And this was very striking, that this man is fastidious as well as in another aspect he is very dirty. This is bipolarity. So I think from these examples, in this part I can make you clear what is bipolarity. Bipolarity comes in various shades, oversympathetic as well as cruel, very courageous as well as afraid, lot of morbid fears. Again, he is very fastidious as well as dirty, in different ways. Now, in this part I will explain another thing. Before prescribing carcinosin, these two important things, bipolarity we find, another is the background. It is very important to find in the patient whether he or she has a background of fear, prolonged fear, persistent unhappiness, or persistent fright, fear, unhappiness, some sorrow for a long period, prolonged. It is very important because this background is very characteristic patients having such backgrounds are most likely, very much likely to be of carcinosin patients. We find patients, suppose a housewife, she had a very bad conjugal life. Husband was very harsh and very rude, and unhappiness, she was unhappy for long period of life. A child is having a very bad childhood, um, parental dispute. We have found children who have been very unhappy. Maybe a single parent was raising him or her, or the parents were having, the child has faced in his childhood parental disputes, and he was the person who used to suffer, not cared properly, not taken care. Then different ways, different types of prolonged unhappiness history we find. A poor boy who struggled through his young days. The father died young, and the child grew up. Throughout his childhood, he grew up among relatives, and different times, different ways of humiliation he faced, different types of suppression, emotional suppression he had to undertake, and a life of hardship till he became a young man and started earning. His whole childhood and young age was very much unhappiness, full of unhappiness. This person is very likely to be a carcinosin patient. Many times we find that carcinosin patients coming from that such type of background show symptoms, characteristics of carcinosin. So this is a very important background we should find in patients. If we are suspecting, if we are finding symptoms of carcinosin, we can search and we can. Now, in the next part, I will talk about the antecedents. The carcinosin antecedents, which are also very important, we can find in the past history, in the family history, even in the collateral family history. There are certain features, certain characteristics, background incidents, diseases, which come as antecedents, and such such antecedents, if found in the background, such patients are likely to be carcinosin patients. So this I will explain in the next part. Thank you and goodbye till then.